Hi there, it's Dr. Grant Pagdin. We're talking again about bioidentical hormone replacement and how can this be associated with activity levels. Well, as men and women age, one of the things that declines is our testosterone levels. Women don't need nearly as much testosterone as men do, of course, but they do need some. Testosterone is particularly important for building muscles and bones and also helping us with recovery after activity. So if you want to continue in the peak level of fitness that you enjoyed in your younger years, topping up your hormones to a little bit more youthful levels would be particularly important. And the one that we would focus on in this regard would be testosterone. Now, it is sometimes also appropriate to replace growth hormone, which is something that's responsible for tissue repair and healing. Helps you to recover a little bit faster after activity. So if your growth hormone levels are flagging off as you age, that would be something that we could also supplement. And this would help you to be able to continue to perform as you would desire.